Hello, thank you for taking the time to watch this video. My name is Stephanie, and today I'm going to be talking about the importance of sleeping, breathing, and airway, and why we're at the dentist talking about these things. Now, you might be watching this video because you were recently diagnosed with obstructive sleep apnea, and you're looking for alternative treatments to the CPAP. Or maybe you're here because you or your partner snores so loudly that you have to sleep in separate bedrooms, and your dentist said they might be able to help you. Or maybe you're not here for yourself. Maybe you're watching this video for a child who was recently diagnosed with ADD, ADHD, or is having issues wetting the bed, and your dentist said they might be able to help. Now, everything that I just mentioned might seem really different, but by the end of this video, one of my hopes is for you to understand that they all might have a common root cause, and that common root cause could be a compromised airway. Now, in the beginning, I am going to focus pretty heavily on children, and that might seem kind of strange, especially if you're here for an adult or for yourself. But what we know now is that children with sleep disorder breathing often grow into adults with obstructive sleep apnea. And some of the things I'm about to talk about, you might recognize as things you suffered from yourself during childhood. So let's go ahead and get right into it. There is a silent crisis in America. Research has shown that 9 out of every 10 people in America suffer from one or more of these conditions. Now, the conditions on the left, things like ADD, ADHD, snoring, low IQ, swollen tonsils, these are all commonly associated with children, while the conditions on the right, like depression, anxiety, cardiovascular disease, diabetes, these are all commonly associated with adults, and they can overlap. Now, how do these conditions start? And how can we start noticing the warning signs in our children? Well, let's take a look. I want you to examine these 3 kiddos right here, and I want you to think to yourself, do they look healthy to you? And if not, what do you see? Well, I'm going to point out what I see. Starting with this first little boy over here on the left, his name is Michael. I'd like you to remember his name, and I'd like you to remember his face because I will be talking about him further on in the video. Now, Michael looks like a pretty average kid with perhaps a weight issue because you notice he has here this double chin. But the thing to know about Michael is he's a normal size and weight for his age. What's giving him the illusion of childhood obesity is a retrognathic or underdeveloped jaw. Basically, his upper and lower jaws are not growing forward the way they should, so it's giving him this illusion of a double chin. Now, the little girl in the middle, she has these dark circles under her eyes, which is called venous pooling, and it's not something we commonly associate with children. She also has these dimples on her chin, which could mean she's clenching or grinding her teeth at night. And finally, the little boy over here on the right, he has these dry, red, cracked lips, which is a likely sign that he's breathing through his mouth instead of breathing through his nose. And he also has a bit of a posture issue because he has this cant to his shoulders. Now, I want you to do the same thing with these 3 little girls. What do you notice about them? Well, let me tell you what I see. First off, this little girl here on the far left, I notice her head posture. It's tilted to the side, and that's something called forward head posture. And it's something that our bodies will naturally do when we're not getting in enough oxygen. We'll tilt our head to the side and stretch it up a little bit to open up our airway so we can get in more air. Now, if left untreated, this posture is going to stick with this little girl for the rest of her life, which is going to lead to shoulder, neck, and back pains later on in life. How about the little girl in the middle? I mean, she's an absolute cutie, but check out the dark circles under her eyes. And more importantly, check out this tiny, tiny chin that is so far back, she can't properly close her mouth and get proper lip seal. And then lastly, this little girl here on the far right, she seems really tired. She has these rosy red cheeks like she's just been running around and has been breathing heavily to get in oxygen. She also has the dry red cracked lips. She has the forward head posture and the cant to her shoulders. And one common thing about all these children is they look tired. So what's going on? And what if everything that we just talked about, things like crowded and crooked teeth, chronic allergies, difficulties in school, dark circles under the eyes. What if they are all linked to a common root cause? And what if that common root cause is a compromised airway? Well, what could be causing that compromised airway? Well, it could be due to narrow dental arches, and those narrow dental arches could be due to things like soft diet, low tongue position, and limited to no breastfeeding. So where did all this come from? A mouth like this is pretty common nowadays in dental offices. And while it's common. It's not exactly normal because this is what a normal or a perfect 5-year-old's mouth should look like. Notice there's space in between the baby teeth leaving enough room for the adult teeth to come in. As I mentioned, this is the perfect 5-year-old's mouth, but it is such a rarity in dental offices nowadays, we're actually calling it an endangered species. It means the tongue is the scaffold for our upper jaws. So much like the scaffold in our home holds our roof in place, the tongue holds the roof of our mouth in place. So what were to happen if the scaffold in our home were to suddenly disappear? Well, we would get bricks that shift and a roof that likely collapses. Well, likewise, if the tongue is not in its proper place holding our roof of our mouth in place, we're going to get teeth that shift. And instead of a roof of the mouth that collapses, it's going to vault and we're going to get a maxillary arch that looks like this Gothic arch here instead of this nice wide U-shaped arch. This tongue was doing its job, right? So now let's talk about the maxilla. You might have heard this term before and you might be thinking it's your upper jaw. And you're not wrong, it is your upper jaw, but it's actually a little bit more than that. So everything highlighted in gold in this picture here is our maxilla. And so yes, it's our upper jaw, but it's also the floor of our sinuses and it makes up a portion of the orbits of our eyes. So if we have a maxilla that is underdeveloped, and that's because the tongue isn't in its proper position, it's going to vault upwards. And it's going to vault upwards because as we talk and as we eat and as we go about our daily life, our oral facial muscles are putting pressure on our maxilla as it develops. So if the tongue's not in its proper place, putting that counter pressure, we're going to have a vault. And when our maxilla vaults, that means the roof of our mouth is up. And when the roof of our mouth is up, what do you think that does to our sinus cavity? Well, it blocks it. So now this quote by Dr. Christian Guilleminault, who headed Stanford University, this is one of his direct quotes. He said, "Our results suggest that dental arch expansion improves SDB, which stands for sleep disorder breathing, in patients with upper and lower jaw constriction and can be valid treatment." So here we have our maxillary arch that is vaulted, and if we expand it, we get it wider, and we get that palate to drop a little bit, what does that do to our sinus cavity? Well, it opens it up and we're able to breathe better through our noses. Now, let's tie that into how that works with our overall airway. So here we have a modern skull or somebody from the 1940s, and as you can see, they have this vaulted palate, they have the malocclusion, they have the crooked teeth, and this is their airway right here. And as you can see, it's noticeably smaller than the prehistoric skull's airway. And you can notice that that maxilla is wider. It's more forward grown, it's not vaulted, and all of the teeth are in its proper place. So now let's talk about how all of this ties together in the functional airway. So if we have a maxilla that is vaulted and it's underdeveloped, it's going to push up into our sinuses, causing an upper airway restriction. And that's going to affect the development of our mandible because as we're growing, our mandible is going to grow to do whatever the maxilla is doing because our jaws naturally want to come together. So if we have an underdeveloped maxilla, that's going to stunt the growth of our mandible. And so the mandible, instead of being able to grow forward the way it was intended, it's going to be locked back in place. And when the mandible is locked back in place, it's going to be causing a lower airway restriction. So now again, this just highlights the importance of proper jaw development because when that lower jaw is not growing forward the way it should, it's going to be locked back in place, creating a lower airway restriction and possibly apneic events as we sleep. So now let's talk about the difference between nasal breathing versus mouth breathing. Now, before I knew what I know now, I thought that as long as I can breathe through my mouth, I'm winning, right? As long as you're breathing, it's the same thing. But it's not. See, when we breathe through our nose, air goes through our nostrils into our sinuses and then our parasinuses, where it is warmed, it is filtered, and it's humidified, and it's mixed with a substance called nitric oxide, which is created in our sinuses. And nitric oxide is a vasodilator, and it has many functions, but some of them are anti-inflammatory, antiviral, and antifungal, and it also helps our bodies absorb oxygen more efficiently out of the air. And then from our parasinuses, it goes right into our lungs for proper assimilation into the bloodstream. Now, if we have an upper airway restriction, we can't breathe through our nose, we're going to open up our mouths and breathe through there. And there, all that raw air is going to go right into the back of our throats. And that's where our tonsils and our adenoids live. And they're not meant to be filtration systems. So they get aggravated and sometimes they swell, which is going to further impede our ability to breathe. And then all of that raw, unwarmed, unfiltered air has to go into our lungs. And most of the time that's going to mean that our bodies are going to have to work a little bit harder to warm that air up because we cannot absorb oxygen if it's not at body temperature. So it might have to work a little bit harder to heat that air up. And then because it's not mixed with the nitric oxide, that vasodilator, it's not absorbing as much oxygen out of that air. So our bodies actually have to work a little bit harder to get a little bit less oxygen. So what does this tell us? Well, it's really important for our children to breathe through their nose, especially in their younger years, those developmental years. It's very important for their overall development. Now, in the beginning of this video, I talked a little bit about ADD, ADHD, and how you might be watching this because you have a child that suffers from it. Now, you might be thinking, why is my dentist talking about my child's ADD and ADHD? And how can my child's sleep and breathing possibly be linked? Well, when you have a child who is not sleeping well at night, you're going to have a child who is not able to behave properly throughout the day. And I'd love to be able to talk further on this subject. However, I'd like to introduce you to a friend of mine. His name is Dr. Ben Moralia. He's a dentist who has been treating children for decades, and he is going to describe the possible link between sleep disordered breathing and things like ADD and ADHD.
Now take a child, alter their quality of breathing and sleeping. And the real big issue now is how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful and learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive and we really want you to have him evaluated for ADD and ADHD.
So what do we do now? Hopefully at this part in the video, you understand why you're at the dental office talking about your sleeping and breathing and airway. And now comes my favorite part in this presentation because I get to show you what we could actually do about it. Starting with Hunter. So this is Hunter. He's a 10-year-old little boy who went into treatment, and these are his before photos, and these are his photos just 10 months into treatment. Now, if you take a look at his bite here, he has what's called a deep bite, where basically when he smiles, you can barely see his bottom teeth. And also, if you take a look at these little 2 white pokey things here, well, those are his adult teeth coming in. And they're coming in above the baby teeth because there's just no room for them. But fast forward 10 months, let's take a look at his smile now. His bottom jaw is coming forward, and here are his adult teeth coming in with plenty of room. And you can really see this forward growth exemplified in his profile. Here, before treatment, he has kind of a flatter face, not much of a jawline. But here you can see where his jaw is starting to come forward. He has that jawline and he really gets that forward growth. Again, this was just 10 months into treatment, but the really cool part about this story is that he stopped wetting the bed after just 1 week. So when his dentist called him to check up to see how he was doing with the oral appliance, his parents were ecstatic because they said he stopped wetting the bed. He actually refused to take it out of his mouth because he knew this is what was helping him. Now Hunter is 10 years old. Up until this point, he couldn't do sleepovers with his friends. He couldn't go on camping trips. And now he can do all of that. And his parents were so happy. They wanted to see what this type of treatment can do for their daughter, Paige. Well, here she is. Look at little Paige. Check out her deep bite. You can't even see her bottom teeth when she smiled. And fast forward again, just 10 months, her bottom jaw is starting to come forward and she has noticeably more room for her adult teeth. And take a look at her profile pictures. She went from a little girl to a young woman in just 10 months. Here you can see where her face is a little bit flat, no jaw definition whatsoever. And here you see that forward grown face, nice jaw definition. Again, this is a really remarkable transformation. And speaking of remarkable transformation, do you remember Michael? Well, here he is. He started treatment at age 9 and ended at age 14. And this is just, again, oral appliance therapy. No traditional braces were done for his case. So here is his profile picture at age 9. There's that little chubby cheek and that double chin here. And age 14, he's grown quite a bit in those 5 years, but take a look at his jawline. That double chin is completely gone and he's way more forward grown. So if you take a line and you draw it right down here, you can see that his chin is barely above that line, where at age 14, he has so much forward growth. Here's that deep bite again. Now take a look at that beautiful smile. In the dental world, this is just perfection. But in the airway world, this is just the cherry on the sundae because this is what we're going after. Take a look at Michael's coffee straw airway versus his garden hose airway. Take a look at that forward head posture that he had. He had such a small airway, he really had to move his head forward in order to open up to breathe. And here he's nice and straight. So if only we had known, right? What about my child? What about my spouse or me? I did spend a lot of time talking about children, so how can we help adults? Well, meet Dr. Tara Griffin. Dr. Griffin is a dentist down in Florida, and she was her own first patient. And just like the other kiddos, this is her before photo, and this is her after photo. So in her testimony, Dr. Griffin talks about how much better she felt. And this is how we're able to achieve that. Now, this is not Dr. Griffin's airway, but it is an airway of another adult patient. And as you can see by these figures, remember the red, the yellow, those are restrictions. Didn't have hardly any green, no blue, no white. But after 15 months of treatment, drastically changed the size of their airway. And if you look down here, their upper airway went from 7.7 cubic centimeters to 24.1 cubic centimeters. Now, that's a growth of over 3 times. And their lower airway went from 120 millimeters squared to 276.5 millimeters squared. That's more than double the size of the airway. So you can imagine how much better this individual was feeling. And the airway results are great. But we also get to see some really cool aesthetic changes as well, because as we're expanding those maxillary arches, our faces are changing a little bit. And this woman went through a pretty remarkable change. This is her before treatment, and this is her just 12 months into our oral appliance therapy. What changes do you notice? Well, for me, I see brighter eyes, straighter nose, and a straighter smile. We're really able to achieve remarkable clinical outcomes, just like Christy. So Christy went to her dentist wanting to fix her gummy smile because she knew she had a retrognathic jaw. Now, originally, Christy saw an oral surgeon for this type of surgery, like an MMA surgery. And her surgeon said, yep, absolutely, I can help you. So what we're going to do is we're going to take your maxillary arch off of your skull, move it forward, stitch it back onto your skull. Then we're going to wire your jaw shut for about 6 weeks. And this is the amount of pain you can expect. And this is going to be your bill. And she went, hold on a second, there has to be another way. So she found a dentist out in Colorado and said, can you help me fix my gummy smile? And he said, yeah, of course. Of course, he was thinking about how is she breathing? How is she sleeping? What's her overall health like? But she was just concerned with the aesthetic changes. And ladies and gentlemen, I think she achieved it. Notice here she has her retrognathic jaw that is set so far back, and after treatment, it's more forward grown. She wanted to fix her gummy smile, and she definitely achieved that. But the cool portion is she started to see some health benefits as well. So this is Christy's own words. She was a blogger, and this is her testimony. When smiling, I noticed that I am now physically unable to smile as big as I used to. My gums are now barely showing. My face feels different when I smile now. I don't know how to explain it, but it's a great thing. She goes on to say, when I speak and eat, my jaw no longer pops. I can speak more clearly and have a noticeable difference in the amount of room my tongue has. I can breathe very well through my nose now. and I'm very happy with my results. Again, she was just concerned with the aesthetic changes, and she just listed 4 health benefits she wasn't even anticipating. But how did we do all this? Well, it starts by expanding the dental arches. It also starts with promoting healthy nasal breathing by training the tongue to stay in the proper position and eliminating bad habits. And that all starts with proper medical screening, going to your dentist and filling out paperwork and surveys to see just how you're sleeping at night. And then that your dentist is going to create a personalized treatment plan just for you based off of your needs. And that's going to include oral appliance therapy that's going to be custom or a guide for our children. And we also are going to include other medical professionals in your treatment. We might include a myofunctional therapist to give you that orofacial workout and to train your tongue to stay in its proper position in your mouth. We might refer you to an ENT to have allergy testing or to have your tonsils and adenoids removed. We might even refer you to an Atlas orthogonist chiropractor to help get that forward head posture fixed. And then finally, we're going to do this with the state-of-the-art technology. We're going to get a 3D scan of your skull and your airway. We're going to get a 3D scan of your mouth. And we're even going to give you a home sleep test that you can take and use in the comfort of your own home in your own bed. And we can collect the data on just how you sleep at night.
I really feel like Vivos is one of the great answers to the healthcare crisis that's in America, because we're getting to the root cause of what ails a lot of us, and that is not breathing well and not sleeping well.
If you trace back the journey of a sleep apnea patient, that patient is suffering for years before they ever get diagnosed. Once they are diagnosed, they're presented really with 2 fundamental options. You can go into CPAP and wear a contraption over your face every night for the rest of your life, or you can have what's called a mandibular advancement device, which will actually protrude your lower jaw in an unnatural position to hold your airway open while you sleep, and you can wear that for the rest of your life. Either of those 2 modalities are going to present that patient with a life sentence of having to wear this contraption, one or the other, every night for the rest of their life.
The interesting thing about CPAP and oral appliances is, although they're very effective treatments, if they're used over a lifetime, the person's condition actually gets worse over time.
Along comes Vivos and says, wait a minute, we have a better option that's all natural, non-invasive, non-pharmaceutical. We can say to a patient, you go into this oral appliance therapy with our protocols, and you go through this treatment for 12 to 24 months. And at the end of that time, there's a high probability that you will no longer have to wear an appliance or any kind of device.
Vivos is literally changing my patients' lives.
It has drastically changed my life. I don't have to use the CPAP anymore. Within just a couple weeks of using the appliance, I was able to breathe through both nostrils, something I couldn't do my entire life. This was revolutionary. Pretty much made me feel excited about life again.
She's sleeping better, I'm sleeping better.
You really feel like you've been given a new life.
It's amazing. I wake up and I'm not in pain.
Because she's sleeping better, because her attitude during the day is better.
I have a better quality of life now. I can't say enough good about it.
I'm getting instant benefit from it. I was amazed. I dreamed every night for 2 weeks straight, and I told my wife, I said, it's amazing. I feel sharp now. I don't feel drowsy all the time. It's been a long time since I felt this good. I wouldn't lay down and try to sleep right now without my Vivos device.
My asthma has gotten much, much better. Without the Vivos, I wouldn't be outside right now. There's no numerical value you can put on this kind of a change. I smile, and I haven't smiled for a long time.
Right after I started using it, I noticed the results really, especially with the snoring. My sleep apnea episodes are a fraction of what they were before. This product's phenomenal. It changed my life.
It's a very comfortable process, but I can see dramatic differences. Now I can really open my mouth. Before it would almost always click.
His ADHD is calming down, he's doing better in school. I can definitely see the difference and the change in him. It's a miracle.
I get to do things now that I would not have been able to. I would not hesitate to do it again.
I am 100% happy that I did this, and I'm thankful every day that I have it because I can breathe.
We bring hope to the millions of people and the millions of families, men, women, and children who suffer from this disease.
It promotes the body's own ability to heal itself, because now the body can breathe and sleep well. That's exciting.